Alive and Well STL is a presentation of the St. Louis Regional Health Commission with the first decade review of health status report to build a healthier St. Louis, and RareGem Productions. Power up with the positive. Learn more at OneRareGem.com. That's OneRaregem.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network.
Substance abuse is just one form of what I would consider an addiction. And in broadest terms, I always think an addiction is when you continue to do something despite the fact that you know it's not good for you. And I know that's very broad, but I think that if we look at addiction in those terms, it helps us level our focus of working with ourselves and working with others. It creates less of a situation in which we can say somebody is different from me because they have a problem.
We'll be right back. What does it mean to you to be alive and well in St. Louis? We want to hear your story. Tell us what it means to you personally, what you need to achieve it, how our program may have helped, or even some of your best recommendations for the rest of us. You can share it on the message box at 314-333-8369. You can send an email to info@OneRareGem.com. You can even post it on Facebook at ONERGP or on the Hallelujah 1600 page as well. We'll share your message with our community to help make it possible for everyone to thrive. It's great to be alive. Be alive and well, STL. 10 a.m. Mondays on Hallelujah 1600. RareGem Productions proudly presenting the positive.
So what does it mean to you to be alive and well in STL?
What does it mean to me? It means finding a contentment in my daily life, enjoying and cultivating good relationships with a handful of people close to me, and finding purpose in my work.
Alive and Well, STL.
This is Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and host of this new program, Alive and Well STL, sponsored by the St. Louis Regional Health Commission. Today in studio, we have Dr. Fred Rottnek, Medical Director of Corrections Medicine at St. Louis County Justice Center Medical Clinic and Associate Professor of Family and Community Medicine at St. Louis University, who also serves on the Regional Health Commission as chair of the Provider Services Advisory Board. It is so great to be with you, Dr. Rottnek.
Thank you so much for inviting me.
Thank you for coming. Please introduce yourself by way of sharing your personal mission or the mission of the County Justice Center.
Certainly. My personal mission, I've always engaged in care for the underserved and the marginalized. Populations in St. Louis that may have a more challenging time accessing care and following through with health care. Coming from, I do as a family, first in the family go to college. I fit in very well with community-based healthcare. I don't like being in hospitals. I ended up coming into corrections medicine after doing several years of volunteer work in homeless shelters. I accepted the role in corrections medicine over 12 years ago, and I've been working with the County Department of Health, always as a contracted employee, for over 13 years. I feel that it's an exciting opportunity to care for the population I work with, particularly with learners, whether they're medical students, nursing students, all across the board, or resident physicians who are getting additional training in family medicine or psychiatry. I feel we can provide excellent care to the population we serve, but we can also impact the learning of these young professionals in the course of their early training.
Over the last several weeks on the show, we've been discussing a report that you know very well as you were on the committee that helped to develop it at the St. Louis Regional Health Commission. It takes a look at health status for the past 10 years. Can you tell us a bit about the report and what you're most proud of?
What I really enjoyed about working on this report is that the report, in my mind, provides two things. It provides a trend of how health indicators and outcomes have changed over the last 10 years, but it also provides a snapshot of where we are today. And also the report, though we tend to focus on the negative, what needs to get done, where we are not yet, this report shows ways in which we've made a difference in the area of those who work together to improve health outcomes. So it had many positive aspects to the report. one of which was just getting all the people together to report the data. That was a remarkable achievement in and of itself.
It's true. It's a challenge to getting all the people together, whether it's in a room or literally in the community. That's still the challenge.
Exactly.
So one of the topics in that report is around substance abuse. It's kind of a sterile term. Can you help me and our audience understand what is substance abuse?
Substance abuse is just one form of what I would consider an addiction. And in broadest terms, I always think an addiction is when you continue to do something despite the fact that you know it's not good for you. And I know that's very broad, but I think that if we look at addiction in those terms, it helps us level our focus of working with ourselves and working with others. It creates less of a situation in which we can say somebody is different from me because they have a problem. Because many of us engage in behaviors that are not helpful for us, but we're resistant to change. What I think happens with substance abuse, particularly if we talk about alcohol, prescription drugs, and illicit drugs, people get into patterns of behavior that are destructive to themselves and to their community, both community in small terms and community in broad terms.
What does it mean to be addicted to something?
Addicted to something means you're using a substance in some way that is creating negative consequences for yourself and for others, yet you continue to use that substance.
But I can stop at any time. I just choose not to.
People may feel that way, but the problem with that is that oftentimes stopping requires change, and change implies that what you're doing isn't working and that you're wrong about something. So sometimes our ego gets in the way of actually making that stop.
Something that I found, too, is that addiction is covering up another issue. So
Yes.
Typically something else is happening in your life, hurt, anger, something that you're trying to mask, not dealing with. So what kind of change do you think might need to happen with a person who has a behavior? It is destructive. Everyone around them is unhappy, but they're not dealing with that thing. What do they do?
Well, see, I think that I completely agree with you on that. I think some healthcare professionals feel that people can just have a substance abuse problem and have no other medical diagnosis, mental health diagnosis. I really don't believe that. And the reason I say that in general is when I speak to students, I have them raise their hands in a big auditorium. Who, when you were 5 years old, had Grandma Hilda or Aunt Betty say, "What do you want to be when you grow up?" Now, how many of you said, "I want to be an alcoholic," or "I want to be a crack hoe"? Nobody said that. Nobody raises their hands. So as I tell my students, if people find themselves in that position at some point in life, it meant that something has gone terribly wrong in their lives. My clinical practice being corrections medicine, so many of my people there who are there repeatedly are there on substance abuse and mental health problems. If people show up and they have these kind of behaviors regarding substance abuse and they have incorporated that into their lives and they are in their third and fourth and fifth decade of life still using, something's gone wrong. So that's why I tend to agree with you saying that if people are using substances, there's probably something else going on that they're trying to avoid, trying to cover up, trying to bury.
When you look at the Regional Health Commission report, there are some trends that are noted in that report. Are there bright spots in terms of the trends or things that you're concerned about that you want to highlight for us?
Well, there's some things that in terms of concerning trends in the area that we all need to be aware of. One is heroin. And as the RHC has been very involved in with the heroin response in the area, that's been very beneficial, and we've actually started to see some improvements in the area on that. The other area that I think we really need to be concerned about, not only in St. Louis but nationally, is prescription drug abuse, which is often the gateway drug. And when I say gateway drug, this is an area that cuts across all socioeconomic data, socioeconomic groups in the area, in that many teens and young adults have their first access to controlled substances because mom or dad or somebody in the family have leftover Vicodin, leftover Percocet, leftover Valium in their medicine cabinet and don't get rid of it. sometimes that is often the way in, and that is a very leveling effect in terms of looking at substance abuse, how it affects everyone. Now, some positive things, which I always like to look at in the area. One is the more holistic approach we're seeing in some of our federally qualified health centers, and as well as the Department of Health centers, in which we're providing more holistic care to patients in a patient-centered medical home context. By saying that, I mean that services such as medical health, mental health, substance abuse resources are co-located in the same building. What that does in a lot of ways is, one, in the mind of the patient or the consumer, the person's able to see that these are not separate or disparate issues. They're all interrelated. And seeing funding streams starting to develop in which those services are co-located is very promising. The other very promising thing we're seeing is we have more effective medication interventions now for substance abuse that we didn't have just 5 years ago. In terms of long-acting formulations for people who are drinking, people who are using opiates such as heroin or prescription meds. And these are encouraging because it allows people to get sober faster. It's not a magic bullet in providing ongoing sobriety. You still need the therapy and the behavior change to do that. But it's a way to address some of the life-threatening immediate issues related to substance abuse.
People often think they'll never be the one to be addicted. What advice do you have for someone listening who thinks they may be dependent and may have an issue with one of the substances or issues that you mentioned?
Well, one question I would have is, why do they feel they may be addicted? Where are they getting this message? Is it change in behaviors, or are they hearing this from people close to them? So ask questions. Ask yourself this question. Another is speak to someone if you're concerned. We have everything from your primary care provider, going to one of the health centers in your area. There are countless hotlines designed for different age groups, different populations, different concerns that can overlap. And there's some objective questions you can ask. If you like to look on the internet, you can look at resources such as SAMHSA, which is the Substance Abuse and Mental Health Service Administration. And you can look up simple questions about whether or not you could be addicted to a substance. It's a way to ask questions and to seek help. But people do need to understand they're not alone in this. There's many resources out there for people looking for help.
Speaking of addiction and watching the news recently, we know that marijuana, particularly there was a feature in 60 Minutes in Colorado, is widespread now. You can purchase it on the street, literally, and it's legal. And in terms of addiction, I've also heard the counter message that is a gateway drug that leads you into other drugs. So what's your professional opinion about that? What should Missouri be thinking about, our moms of young kids who are saying marijuana is fine, it's not the same as another drug, it's not cocaine?
Well, it's not cocaine. But the legal drug in our country is alcohol. And when I work with patients at the jail, alcohol is the drug that can kill you the most easily. So lethality is not often the issue. I think the issue is, why are people seeking to use marijuana on a regular basis so often that it impairs their life, their motivation, and their relationships with others? I think we would want to ask the same questions about, if you want to use marijuana so often that you no longer feel the concerns or pain of daily life, why are you avoiding those root concerns or problems that you're having?
Are there any particular signs that we should look for to know or understand if addiction might be part of a problem?
Certainly. There's certain behaviors that are well documented in people who have problems with addiction, such as if people begin to neglect their responsibilities, not showing up at work, not spending time with their children, not being a good spouse or partner. We see a lot of that in terms of just plain behavior. Are there changes in someone's behavior? Are people no longer enjoying what they used to enjoy? Are people giving up on hobbies? Are people getting into legal problems? That's something else that is a big issue. Other things that people can ask themselves or see in others, are people building a tolerance up to drugs? Maybe before, if you'd go out and have fun with friends, you'd have a couple beers, but now you're having 6 beers or 12 beers. Are you developing a tolerance? Do you use drugs to avoid withdrawal symptoms? We've all heard stories about the gentlemen who drink all the time and then they stop, they get the shakes, they run to the liquor store and get another drink and self-medicate. Does your life revolve around drug or alcohol use? Do you feel like you're spending your time or arranging your schedule so that you don't miss that trip to the liquor store, or you're getting a hit, or you're not going to miss that meeting with somebody to pick up a drug on the street? And then, of course, like we get back to that idea of addiction overall. Are you continuing to use drugs or alcohol even though you know that pattern is hurting you? And I think that is the real telltale indicators that people start hating themselves for using something that they at one time enjoyed.
Many of our listeners are people of faith. They have a strong faith tradition. Prayer is very important. Investing spiritually is very important. And sometimes we can think it's either or. Is there a way that we can combine medicine with faith? And if so, how do we do that?
Certainly. I would like to, my short answer is medicine has a place with faith because God made pharmacists too. In a broader term, I would say that we have different people in our lives for different reasons, and we have different resources for different reasons. I think that part of our flourishing as human beings is developing solid relationships and knowing ways to help each other. And I think medication and understanding how our body functions uniquely, how we can enhance the quality of life of others is an important balance. I don't think that all of life's problems can be solved by willpower, or else we'd have a much simpler and happier world. But we're frail human beings. We have our faults. We have our strengths. We have our weaknesses. And I don't think relying on one strength all of the time is effective, or else we wouldn't have such a thing as arrogance. So I think there's a place of collaboration and working with issues of substance abuse.
Do you have any recommendations on how to begin opening up conversation like this that might be uncomfortable, or other topics that tend to be a little bit sensitive?
Sure. I always say when I'm training medical students, don't start off your first interview with a patient asking about sex, drugs, and rock and roll. You save that to later on, okay? I think the key way to approach folks if you have a concern about substance abuse is to build on the strength of your relationship. It takes a very well-trained and effective therapist to dive right into that problem right off the bat. And I'll admit I don't have those skills. When I see a patient, we talk about past medical history. We talk about aches and pains. We talk about what brings somebody in today. Towards the end of my conversation, I talk to them about sexual habits, about substance abuse, about relationship concerns. I mention that because I think the same thing is true with people who are not healthcare professionals. Having a solid relationship where you feel comfortable speaking with a friend or relative is the best foundation you can have for asking someone if you're concerned if they have a substance abuse issue. People know you need to reinforce that you love them regardless of what they are doing. And unconditional love is important. Letting people know that you are asking for their well-being and the well-being of your relationship and the relationships of those close to you is important. That being said, it's very easy, I want to say, especially with people of faith, but all of us who really have a strong conscience, to take this personally. It's very easy to blame oneself for the behavior of one's kids, family members, thinking, it's my fault that this person has this bad habit. That doesn't get anybody anywhere. You need to focus on the outcomes you need, and you need to be able to ask for help for yourself as well as a person you're concerned about.
Switching gears for just a second, how would the lack of Medicaid expansion in our state impact our access to quality mental health, substance abuse treatment services?
It takes us from bad to worse. One of the very exciting aspects for me personally, and I think for all people with one foot in public health at least, is that with the Affordable Care Act, we have something with mental health parity at a level that we've never had before. And that term mental health parity means that we no longer segregate or silo issues of mental health to that little number on the back of your insurance card, which is what we're all so used to doing. Rather, mental health care and mental health wellness is considered one of the core components of the Affordable Care Act. The Affordable Care Act, Medicaid Expansion being one aspect of that, would greatly increase the services and funding for training of the providers that we need in the areas of mental health and substance abuse. If we pass up the opportunity to expand Medicaid, we're passing up the opportunity to have greater access for the services we have now. And quite honestly, if we pass up Medicaid expansion, we're also going to lose many of the services we have now.
So as we begin to close today, is there anything else that you'd like to share with listeners?
One is, as I mentioned, nobody aspires to be a drug addict. Nobody aspires to be weak or defeated. We need to keep that in mind because working with or living with, sharing one's life with an addict is very difficult. And realizing that they are in an unhappy place, sometimes more than these people are, realize it themselves is something that's important to keep in mind. Another issue, as you said, is that substance abuse is often covering another issue. It's often the tip of the iceberg. It's the thing we see. We need to encourage that to be alive and well means addressing why are we engaging in behaviors that are self-destructive. And by going to the root cause, we can really seek a fullness of life that's much more enjoyable for ourselves and those in our community.
Thank you, Dr. Rottnek, for joining us today and for the work you continue to do in our region and on behalf of our community. Take charge of your health today. Imagine yourself tomorrow healthier than you are today, and take one small action to get you closer to that goal. We'll be back again next week. Thank you.
Thank you.
Alive and Well STL. Thank you for joining us today. For resources available, go to aliveandwellstl.com. If you have more questions about the program, need help, or want to connect, please call the message box at 314-333-8369. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.